I think it's a bit unfair to blame AI for not having given us an early warning. Nobody set up a worldwide early alarm AI system. We have human ones, and they didn't work too well either. So it's a bit unfair to blame AI for not having been first to the punch. There are some teams of researchers who claim they did spot it early. I think it's too early to tell just how true that is. And in general, it is still early for AI generally. We forget AI is kind of 60 years old. It started in the Dartmouth conference in 56, but really it only got powerful and effective in 2012 when we had the big bang in AI, when machine learning was able to be deployed to it. So it's a very young science. It's a very young technology. It's growing exponentially. And one of the interesting things about this virus is the virus has been growing exponentially. So people are getting a really upfront, close personal look at exponential growth. And maybe that'll help them understand how AI is growing. 5 things that AI teams are working on with regard to the virus. There's obviously, probably front and foremost, is developing the vaccine. There's also diagnosis. Helping understand whether people have got temperatures, whether they're infected in some way, and various aspects of tracking and tracing as well. There's been all the debate about the Apple and Google app, which uses AI in the process of letting a smartphone belonging to somebody who's been infected let other smartphones that it's been near know that they've been near somebody who was infected. And there's been the big debate in the UK about whether the NHS should have its own app, which collects data in a central location. The obvious downsides of that are privacy downsides, and that's why Apple and Google haven't gone down that route. Yet to be determined whether the UK will stick with its NHS-created app or go with the Apple-Google one. My hunch is that they will end up going with the Apple-Google one because the NHS doesn't have a brilliant track record in developing software. Well, the first and most tragic one is that a lot of people are going to die. A lot of people have died, and many more will die. So that's a huge lasting impact. And of course, also the financial impact, especially for the economically vulnerable. So deaths and financial damage are going to be seriously important long-term effects. Looking beyond that, clearly we've all been forced to work remotely and have a lot more remote meetings. And a lot of people have actually quite enjoyed that and found it quite useful. So I think it will accelerate the acceptance of remote working. But it's also the case, and you're hearing a lot of people say that meeting via Zoom is quite tiring. And the reason for that is that there's a latency. The signals, the visual and the audio signals are not necessarily completely in tune. And also, when you're not face to face, you don't get all the rich depth of the signals that our faces and our gestures, our positions, as well as our voices are conveying. The other impact that people talk about is automation. The choke point of automation is whether the technology can deliver it. And this virus isn't going to speed that up. I don't think we're going to have a huge acceleration in automation. I think that is just progressing anyway. Another effect is possibly people will get a little bit more selective about their governments. And finally, I guess the most important impact that this virus should have is we really better prepare for the next one. This one was not a black swan event. Bill Gates warned about it 5 years ago. Hollywood made quite a decent movie about it, Contagion. We know that there's going to be another one. So let's get ourselves better prepared, much better prepared for the next one. Obviously, the tech industry has proved its value because we're all using it day to day with Zoom and social media much more than ever. And the tech industry, I think it should do well. It's certainly probably more robust financially than many other parts of the economy. Whether its PR will improve, yet to be seen. And clearly, the healthcare industry, demonstrating its vital importance. The heroism of the nurses and doctors. I mean, it's hard not to get emotional about this. Those people putting themselves in harm's way day after day to take care of the rest of us. They richly deserve their weekly Thursday applause, and they richly deserve better pay coming out of this. And an industry which hasn't had much attention, and I find very interesting, is agriculture and food industry. In the early stages of the pandemic, there was panic buying, although admittedly more of toilet paper than anything else for odd reasons. But it's been very interesting how food production has hardly missed a beat. There is no shortage of food in our supermarkets. And that's partly because the agriculture industry is astonishingly automated. Unfortunately, yes, I think there will be a growth in inequality, particularly if you zoom out and take a global perspective. Poorer countries are simply less well able to cope with this, and they're going to lose a lot of their populations. They won't be able to respond to it as well. And so that's going to have a damaging effect on those economies. Within the economies of each developed country, yes, I think there probably will be a negative impact on inequality because simply poorer people are more vulnerable. But I'm going to say something which will probably be very unpopular, which is there is a bit of a myth that we live at a time of staggering inequality. The Gini coefficient, which is a bit of a rough and ready measure, but it's the best single measure we have of inequality, really hasn't moved in most of the West in the last 30 or 40 years. It has in America. America's got more unequal, but even there, a lot of that is due to not the 1%, but the 0.0001%. You know, Jeff Bezos, Bill Gates, Zuckerberg, and so on, getting much, much more wealthy. And again, this will be a controversial observation, but Jeff Bezos getting very much richer doesn't really affect me and doesn't affect the people in my town. The relative inequality between ordinary people hasn't actually got much worse in the last few decades. We are not living at a time of exceptional inequality. We're living at a time of amazing wealth in our societies. Think about how what was possibly the previous pandemic on this kind of scale, the Black Death in the Middle Ages, it killed half of Europe. And they didn't know what it was. We are in such a better position, thanks to the Industrial Revolution, thanks to the incredible increase in wealth in our societies. And that's mainly down to technology which is improving on an exponential growth. It's going to continue improving. We're in a hiccup. It will continue improving on an exponential rate. And our world is going to get richer and better.